Most of us have picked a new bedtime habit in the last 10 years or so. We scroll through our phones in bed. Some of us look at Instagram or Twitter. Some of us watch YouTube videos. Others watch films. We all do it. Imagine doing this one night and suddenly going blind. You would probably panic, right? One moment you're scrolling through your phone. The next moment you can see only darkness. This actually happened to a 30-year-old in Hyderabad. She was diagnosed with blindness for almost 18 months. She would see floaters, bright flashes of light, and dark zigzag lines, but nobody knew why. That's when the patient was referred to Dr. Sudhir Kumar, who's a neurologist at the Apollo Hospital. He realized that the woman was suffering from SVS, or smartphone vision syndrome. This patient used to browse her phone at night without turning on the lights. Dr. Kumar diagnosed this as the reason behind her blindness. I know you have a lot of questions right now, like what happened to the patient eventually, or how do you identify SVS and whether it's treatable or not. So let me go straight across to Dr. Sudhir Kumar, who is joining us this evening on the show from Hyderabad. Dr. Kumar, thank you very much for your time here on Mirror Now. Can I please start by asking you what ultimately happened to the patient? Did she get her vision back? Did she not get her vision back?
Thank you very much. So the good news is that the patient was counseled that her visual symptoms of seeing floaters and blurring of vision, they are related to her overusing or looking at the smartphone screen and also browsing at nights in the darkness. And she understood, and she had a lot of anxiety initially, but she accepted to minimize. In fact, she told, I don't need to use the smartphone. It's only for recreational purposes. So let me minimize it to the basic minimum. And then the good news is that after about 30 days review, she had gotten her vision completely back and she was absolutely fine.
Dr. Kumar, then can I ask you what exactly is SVS? Are we panicking here? Because I know a lot of people are watching this broadcast or have seen your viral tweet and are wondering to themselves that this is almost an extension of ourselves. This is with us everywhere. You feel insecure. Even when you're going to bed, you feel insecure if this is not next to you. And all of us are guilty, doom scrolling at night before we go to sleep. So what exactly is this SVS and just how dangerous can it be?
Yes, so the good news is that it is not very common, number one. Second thing is people who browse for hours together without taking any breaks, and especially at nights in complete darkness, they are more prone to it. So the message here is that we cannot live without watching at the digital screen, whether it's a laptop or smartphone. But it's a small group of minority of people who browse extensively for several hours in the day without taking any breaks. And also, they browse at nights in complete darkness for 1 to 2 hours. So they are the people who are prone to it. So, but basically, if somebody has to use it for routine purposes, what we recommend is that you can browse the phone but take a break, and that is called as 20-20-20 rule, which means every 20 minutes take a 20-second break from looking from the screen and look at some object 20 feet away. And if one does that routinely, then the risk of getting this kind of vision problem is very, very less.
Okay, so doctor, what if I wear specs? Will that shield me from SVS, as it were?
I think there are some instrument devices where they say they can screen the blue light filter and things like that. But still, if somebody has to use look at the screen for several hours, especially like we have many software professionals, many people who do jobs looking at the computer screen and the phones, that is fine. So basically, whatever is essential, one must do, taking breaks. But recreational use, people watch videos, people watch movies for non-stop without taking any breaks. So that is the use we can minimize and cut down the risk of vision symptoms. So these devices, spectacles may reduce the risk, but that is not the foolproof method. The best method is to reduce the use and take breaks every 20 minutes for few seconds, for 20 seconds.
Okay, so doctor, are there degrees as far as SVS is concerned? This lady in Hyderabad, your tweet I think went viral because she lost her vision completely, and that's very scary. Are there degrees to SVS, and how do I know that that's what is causing my vision issues?
Yes, there are degrees. So, minor visual symptoms like seeing flashes of light or some floaters, they are quite common. If somebody looks at the computer screen non-stop for more than 70 to 80 minutes, most of us have had that. Suddenly if you move your eyes away from the computer screen, you would see some flashes of light, but that lasts for a few seconds and they go away. So that is very natural. But if these symptoms become repeated, like in this woman whom I saw, almost every 5 to 10 minutes she was having flashes of light, zigzag lines, and nights when she got up to use the washroom, she could not see anything for a few minutes. So this kind of severity is fortunately not common. It is very uncommon. I would see a case of say smartphone vision syndrome once in a week, but this kind of severe symptoms in the last 1 year, only one patient and maybe one other case I have seen. So severe symptoms are not common. That is very good. Most patients they have minor symptoms, and how we know it is smartphone vision syndrome is that the moment we minimize the use of looking at digital screens, whether it is smartphone or computer, the symptoms start coming down, and most people start getting better in a few days time, and in few weeks they become totally normal. So that is the only method to confirm that the symptoms were due to the excessive use of looking at the digital screens.
Okay, Professor Kumar, before I let you go, can you give us a protocol? What is the protocol when you're using your smartphones to avoid SVS?
Yes, that's very important because prevention is better than cure. So, number one is to reduce the number of hours of usage. So, as I said, for the jobs and the work, many people have to use, even college students and other students, they have online classes. That's a must. So, beyond work, the use should be minimized. Many kids, they play even video games and games on the phones. They can again restart playing outdoor games. And then, as I mentioned, we should follow the 20-20-20 rule. So every 20 minutes of use, there should be a break for 20 seconds and look at an object that is distant about 20 feet away. So that gives eyes some kind of relaxation and the eye muscles some kind of workout, and it prevents these kind of visual symptoms.
Dr. Kumar, thank you very much for your time here on Mirror Now. This was an important conversation to have. Actually, this is the first time I've heard of blindness because of a smartphone. Is a smartphone then making you dumb and blind? Is a question I think a lot of us will have to ask ourselves. Dr. Kumar, thank you very much. Appreciate you taking out time to speak to us. Thank you very much indeed.
Thank you. Thank you very much.